Well, September is Childhood Cancer Awareness Month, and more children and young adults are surviving cancer. There's a very good thing with that. A number of programs have been created to help optimize the quality of life for these young people. Here with more on that and how you can get involved. It's called the Enduring Survivors Program, and what it does for people here in New Mexico. Dr. Linda Boutros, the director of Young Enduring Survivor. She's also a pediatric oncologist. Yolanda Vinajeras, supervisor of social workers with UNM Pediatric Hematology and Oncology, and Vicky Ruiz, the pediatric oncology liaison for the Children's Cancer Fund of New Mexico. A lot of titles there, ladies. You do a lot of important things. Thank you so much for coming in this morning. It's good to see you. So let's talk about this group that you have, that you are all in support of, Young Enduring Survivors. What is it?
We have a program for childhood cancer survivors of all ages. They have to be 2 years off treatment and be basically finished with their chemotherapy and radiotherapy and all the things that they have to go through to survive their cancer. And then they come to our clinic 2 years later, and we try to help them get back into normal life, get back into successfully reintegrate into society and into their schools and so on.
So let's just start first. This is what you deal with as a doctor. What is that process like for children to go through chemotherapy, radiation therapy, and just to have cancer? It cannot be a fun time for them.
No, it's incredibly challenging, but I'll tell you, it produces some incredible people because of that challenge. They're very unique and wonderful human beings.
I imagine so.
But it's trying. It's physically, mentally, and emotionally very trying for these.
So after that, they work a lot with you all, and particularly too. So what is the process like? You're talking about 2 years after they are cleared of the cancer. What are their lives like at that time? How are they different from normal, not normal children, but children without cancer, even 2 years after it's cleared?
Well, they certainly are different. I think they've faced challenges in their lives that most of us have never faced and hopefully will never face. And sometimes people liken it to people who have come back from a war. There are certainly symptoms, and sometimes they're referred to as post-traumatic.
Sure.
Not all of them. However, we're seeing more and more survivors. I think the studies are showing that there are definitely side effects. And so it requires support. It requires a transition time. Most of these children have lost friends over the years. Friends fall off, especially teenagers. They feel isolated, they feel alone. We see depression. We also assess for school services. Oftentimes these children have learning disabilities or sometimes have attention deficit disorder. Not all children, I'm speaking just a segment of the population. So we're constantly developing and assessing programs for these children so that they continue to be successful in life.
I just want to ask you real quickly about the PTSD. Is there this thought that the children have, maybe this, I don't know, like a nagging feeling of being afraid of having the cancer come back? Is that one of the things that they have, kind of the battles that go on inside their minds?
Sometimes, and sometimes we don't see that until they're young adults and the reality of their treatment and the life-threatening sort of component of what they went through becomes real to them.
So what kind of support do you give them with the group?
The Children's Cancer Fund, in terms of the Young Enduring Survivors, one of the most exciting, I think, services we provide is scholarships. So we do help pay for college scholarships because the cost of treatment can be expensive.
Sure.
We also provide mental health services. As Yolanda was saying, we're just now beginning to see, or we have seen, but beginning to work with some of the really deeply seated emotional issues around the treatment and then the recovery process. In addition, we provide gas services and meals to families who come back and forth for treatment. We provide awesome prizes for the kids after every treatment, after every appointment. We also provide our Artists in Residence program, where we provide art services to our kids. We also provide tutoring services for children and young adults who need additional help with education. So wherever the need is where we go.
I'm sure you see this a lot, Dr. Boutros, but it seems that families seem to struggle a lot, not just the children, because of not just what that child is going through, but simply the cost of everything involved with it. And as they mentioned, even after the cancer has been cured.
That's true, and it's not even just a financial cost. It's a cost emotionally. It's a relative neglect of other children. And the other thing that you have to remember is when these children survive, there's still a lot to think about.
Sure.
We have to look at their heart health, their lungs, how they're functioning. They're more prone to fractures a lot. And so there's many, many tests that are going on many years after they've completed their treatment.
So it's not okay, thank goodness the cancer is gone. It's an all clear.
Right.
Not that at all by any means.
And of course the CAT scans and the MRIs, and in this day and age, the co-pays are exorbitant.
Yeah, insurance.
I mean, it's a lot to deal with for a family.
Absolutely. So can people help out? Is there something that that the community can do to get involved?
Absolutely. I think the Children's Cancer Fund is a companion piece to our program. They raise funds. They have some large fundraisers throughout the year that people can participate in, and I think they can contact the Children's Cancer Fund.
Contact the Children's Cancer Fund, where we seek donations. We have fundraisers. This is Childhood or Cancer Awareness Month, so of course we're doing a lot of extra with a cancer walk and also with other items or other opportunities this month to give back as
And
well.
I think just talking about it, letting people
Yes.
know that
Yes.
there is this need out there, just something for everyone to be aware of, certainly helps with
Yeah,
the issue.
absolutely.
Okay.
Absolutely.
If you want to find out more about it, what the Young Enduring Survivors Program is, UNM Children's Cancer Center, and the Cancer Fund, and all of that, head to our website, krqe.com. Click on links. Ladies, thank you so much for coming in this
Thank
morning.
you.
Thank you
Thank
for
you.
it.
Thank
Appreciate it very much.
Thank you.